Introducing Celigo, the complete integration platform built for both IT and business users that automates your business processes across applications. With Celigo's guided visual interface, building powerful integrations is a breeze. You can leverage hundreds of pre-built connectors to automate key business processes across popular applications. The result? An agile company set for growth. Celigo. Integration starts here. Visit Celigo.com to get started.
Thanks for tuning into another talk here at the Product-Led Festival. Hope you're enjoying the event so far because we've got even more juicy knowledge and insights from product-led pioneers heading your way. Remember to have your questions ready and get the tailored answers you need from the experts themselves. Sit back and enjoy. Hello everyone and welcome to the next session at the Product-Led Festival. We've got a great interactive session coming up for you next with Ruth, who is the Director of Product at Doctor Care Anywhere. And Ruth is going to talk to us about better retention in health tech. We're going to make this session, or try to make this session, interactive. Ruth has prepared a Miro board, which you can click the link to at the top of the chat. It is pinned there and the password is better together, all in lowercase and all one word. So do get involved, share your comments, feedback, questions, and Ruth will get to it in during the presentation. So without further ado, I'd like to hand over to Ruth. Welcome to the virtual stage.
Guten Tag. I might need to point out that I just did a little bit of Easter egg fun with my team. So if I am overexcited, it's because I had to taste lots of chocolate, and that's always good fun. So I can highly recommend it as a team event. So, and now it doesn't, there we go. If all goes well, we will learn the following today. How, in my opinion, successful product teams work cross-functionally, my learnings around retention so far, and applying all of the above to digital health tech. I'm saying always me or how I see the world because every product team is different. Everybody learns differently. So I want to share what I've learned and then hopefully also hear from you what you've learned or what you think. So why am I here? Why do I think I should even talk about this topic? So my experience, as you can see on the wonderful Miro board, I've worked in the US. I'm originally from Germany. I've been living in the UK now for more than 15 years. I have worked in startups, scale-ups, and I've seen many screw-ups. Industry-wise, I have worked in telecommunication, I've worked in home improvement, and my last two companies were in the health tech space. From a leadership perspective, I am a Mo Raptor. Not only because this sounds like a dinosaur, it means I like to interrupt, but I also like to, disrupt, not interrupt, but I also like to motivate, to make things happen, to have fun while doing things. So let's talk about product. So I believe that successful product teams need to dream in years. This means you need to have a product vision. You need to have the 2-3-year-old vision that guides you in everything you do. I believe that you need to plan in months. We, for example, use OKRIs, so objectives, key results, and initiatives. And I see somebody's using the Miro board and moving it. Perfect. And within these, we plan in 3 monthly iterations. That's also for us an opportunity to get the company together, to align ourselves what we're doing from different business angles. I believe that you need to discover weekly. We're not quite there yet, but we're making big strides in the right direction. What we do not want to do is have big discovery projects and then build projects. What we want to do is discover in small iterations and build alongside. And we're getting there slowly, which means we have a UX team now. We have UX designers and designers to help us also facilitate that discovery. I believe that we need to release daily. And this is not really about releasing. This is about the mindset. We're trying to have a mindset of small iterations rather than big mammoths. So if you build for 3 months and then you get something out, that's 3 months wasted. So why can you not build smaller pieces to then quickly learn and improve? And this is something that also needs to be in the mindset of everybody, not just product and tech. It needs to be in the mindset of marketing for us, it's the doctors, for everybody. What are the small little things, along with our OKRs or OKRs, to get into the right direction? Measure every moment. We have finally implemented a tool we're using, Amplitude, along the entire customer journey, which is very helpful because we can measure on iOS, Android, and web, and we can compare, because that makes a big difference for us. User-centric, always. We always have to have our patients in mind. We always have to have our GPs in mind, and we also have to have our patient experience team in mind. But this goes beyond this. User-centric for us is also how we work internally. And this is only one example of us trying to have some fun. And we're always trying to improve the way we're working together. Because all of this sums up, behavioral change drives business results. So I believe this is what a good product team needs to do. This is what you need to do as a company, because the product team is in the heart of the company. It needs to bring all of this together. And these behavioral changes, and we, for example, are growing now very fast, need to be brought into everything you do. The way we work with other teams, the way we work as a team, the way we're trying to improve the behavior of our patients and our doctors in order to drive better business results. So once again, this is my opinion. Every business is a bit different. User-centric to me is internal as well as external. And as you might have seen, this is an iteration on the book, Product Leadership, which I could highly recommend for you to read. And I used this as a starting off point, and then as any product manager would do, I iterated. About 4 or 5 years ago, I noticed that leading a product team is good, but you also need to understand how you grow the business, how you grow your user base. And this is when I started to dig into growth, retention, and engagement. And I started this by joining 2 programs with Reforge. And one of the sentences really stuck with me. This is the one from Brian Balfour, who's the CEO of Reforge. And he talks about growth is good, but retention is forever. I have since also joined a program with Sean Ellis, and I think the general thinking is very much aligned. But in general, while growth is good, and you need this to start off with, you at some point need to think about retention. How do you keep your user active over time? Let's break that down a little bit further. So retention is a combined effort of acquisition, engagement, churn prevention, and resurrection. I'll show you later that we haven't managed all of them yet. We're in the starting line, but it's this combined effort that will drive to keeping your, for you it's users, for me it's patients, engaged for a longer period of time. So retention is the output, and I will show you a little bit more about that later. If we break this down a little further, so, and I will show this then also in our setting, we're trying to get people to the sign up. We're then trying to get them set up. We're trying to get them then to the aha moment. And that's one of the things we're currently working on. How do you create a habit? And as you would imagine for health tech, that's a little bit tricky because you really don't want to get the people sick. Dormant and churn, we haven't done as much on yet. We have realized that it's very clear that tracking the data is not enough. You need to understand the path they took and their emotions, motivations, triggers, and rewards along the way. This is especially necessary in health tech, where it's about patients and making sure that they're healthy. Increasing engagement. Once again, this is from the Reforge perspective. Is done by adding use cases, by increasing frequency, by increasing feature usage, and increasing intensity. I'll tell you a little bit more about this when we get to this slide. And I need to end now here so I can better show you. So Dr. Care Anywhere is a health tech company in London. And we started off with virtual consultations. Our product vision is to enable you to manage your and your loved one's health effortlessly, quickly, and appropriately. And in the first instance, this was all around this area. So we wanted to make sure that we get you quickly through verification, completing your profile, so you're ready to book an appointment whenever you need an appointment. Then within the appointment, you would get triaged into a waiting room, and then you would have your consultation, and then we would publish the notes. What's unique about this is that you have your notes then in your app or on the web. They're yours to review any point in time. You can then book follow-up appointments, and it starts all over. We have since then extended our journey, and this would fall into the use of adding extra use cases. So we've built the bridge between primary and secondary acute care, and we're now building the bridge to a mental health offering, which also enables us to look at longer term care. And I'm going to take you a little bit through this to show you. So what you can do is, if you have the right eligibility, you will have a consultation with our doctor, and then we added a use case, as we've seen earlier, to go through diagnostic. And the beauty of this is that you will have one appointment in a hospital, and the rest is all done online again. So once again, at the end of when you go through this diagnostic pathway, you will have all your notes in your app. You can review them, and you can share them with, for example, an Onward doctor if you want to do this. So if you look at the retention and engagement, what we've built is, because retention is measured from the time you initially signed up, we built the first new use case. We've now added, and I mentioned this above, we are adding, and I'm going to put this up here, we're calling it My Health. And what we do in My Health is giving you yet again another reason to come back, another reason to increase the frequency of you using Dr. Care Anywhere. We are offering mental health proposition now, which means that you can book an appointment with a GP with mental health training, and they will also guide you then into further help if needed or required. We're also extending this into offering wellness offerings or self-guided things you can do. And I'm going to pull these up there. So by doing this, we're increasing the frequency for people to come back. We're increasing the intensity. And as I've shown above, we're adding new features. This area is also, I'm calling it gently the engagement machine, because what you might understand very clearly, hopefully, is that we don't only want to have you when you're sick. So what you will also see in this engagement area then is us adding content. So how can we keep you happy and healthy? How can we give you guidance when needed, and give you this guidance without having a doctor's appointment? This is why we're building this area, call it a logged-in experience, where we're trying to then intensify more that you're coming back more often for different reasons. So this is where we are at right now. The journey has just started. It's full of new adventures. We're currently building quite a few new pieces, which I can't quite reveal yet, also because we're now a publicly trading company, and that might not work in our best interest. That would have been my suggestions around retention in health tech. And I'm wondering, I'm going to zoom out and see if there's any questions. Is there any questions? Don't see any questions. No, nobody has any questions. Heather, can you see any questions? Because I'm happy to dive into areas deeper if there's any clarity or questions asked.
Not yet. People, if you've got questions, feel free to drop them on the Miro or here in the chat, whichever is easiest for you. I can see lots of people moving around in the Miro. So yeah, feel free to ask questions and get as interactive as you'd like.
So I think well, I'm totally happy to get interactive now and see what questions you have. I think the three areas which we haven't really dove into yet from a Dr. Care Anywhere perspective is the number of total engagement. It's hidden behind there. Engagement per active user and engagement on different categories. And the reason simply is because we're at the beginning of building this engagement engine out. We've built the first bridges, we've built the first use cases, but now we actually need to spend quite a bit of time to figuring out how can we help our patients better. And that's what we're currently doing. So what are the other pieces? Well, we have already built bridges, and we're having already torn down silos. We want to know, we need to figure out what can we do next, what is helpful to them, what will keep them engaged. And that's a lot of the things we're currently doing. How do you improve retention in health tech more on the doctor-patient area? So what we can do, or what we are doing, is that when you do the booking here, the patient can actually choose, because this falls into the lifelong relationship piece. And so you can rebook the same doctor you had before, which we notice people will do. Only they will not book the same doctor if they actually have something really urgent and the doctor is not available right away. And so this is what we will keep doing, to have the availability that you can speak to the same doctor. This will not be the case if you're, for example, then choose a mental health pathway, but even then you will always have the same doctor talking about your mental health issues. I hope that makes sense. Are the doctors considered secondary users, customers? No, our doctors are as important as the patients. It's kind of like, it's not a two-sided marketplace, but we have to have the right supply of doctors available, so they have the same level of necessity as the patient. There's no question that we need to make sure that the doctors are engaged, that the tools we're building from them are always improved, and a lot of the testings we're doing on two sides, so the doctors can also see what we're doing for the patient side, because it's very important that you can see both sides. So no, they're the same. So to me, it's the doctors. This is actually to us. This is the doctors. We have a few other clinicians. They fall in the same category. It's the patients, but also for us, it's the PX team. It's the team that, if something does go wrong, talks to the patient and then connects them to the doctor again. So for us, it's the three layers. How do you extract user insights once users are in the journey? We're using a few things. So we're using, we're actually also offering patients, if they're interested, to do more user research with us. And then at every end of every consultation, there is a survey, and where we ask for feedback. And that's how we make sure we close the loop. We also make sure that we take the feedback from the PX team. And so we have a 2-weekly session where all the teams that have insights gather and share their insights in their learning, because it's super important that pretty much everybody knows what's happening. And we only started this a short while back, but it has already shown as super helpful. For example, if the complaints team are sharing some of the things they've learned, to share this with the UX team, the marketing, and so on. And we'll do more of this as soon as we hire more people. So if anybody's interested in joining as in the UX area, we're looking for people. Anybody, any other questions? I'm going to take another look on the Miro board. You can see I didn't lock this. That's fine. No? Let me point out then, if you do want to get in contact, you can find me on LinkedIn. It's here on the Miro board. I wrote down Clubhouse twice. One is Twitter, one is Clubhouse, and one is Twitter. Yes, and there's the link. If your sales team selling your product to health clinics or insurance companies, that's a very good question. Actually, I should have mentioned this earlier. Thank you, Lauren. We are actually working very closely with AXA and AXA Health. So yes, we are working with an insurance company. And what you can see here is this is the pathway we built together with AXA Healthcare. And that works really well. It's a joint venture with them. So that means that we have a supply of hospitals, and also we have then a supply of the customers coming in and they having the right insurance. Just reading, or insurance company. Yes, we're also, sorry, it's not only AXA, but there's also other health clinics we're talking to and we're working closely with. You would, for example, see that we are behind Nuffield, and there's a few others that we work with closely. Anybody, any other questions? If there's none now, please don't hesitate to contact me. And I'm quickly, because I can, will write Twitter on here. No, I can't because I locked it, so we wouldn't move it around. Sorry. Ashley says, hi there, I'm also in health tech. We're struggling with not knowing whether a consumer didn't return because they didn't need care or if there wasn't any other reason. How do you look at that today? We're not doing the best job yet. And I think we all know that closing the loop is a challenge in health tech. What we will start to do is follow up after a while. And what I mean by this is that once you've done your consultation, depending on what the output is. So, for example, if you had a prescription, that we then follow up and ask if the prescription was actually helpful. So, Ashley, I'm sorry to say we also haven't nailed that just yet. My ideal North Star is to make sure that we turn everything into a happy, I call it happy treatment, which might be a little bit flippant, but what I mean is that whatever goal you set yourself when you came in to our app, that we can help you. And I'm happy to connect, Dominic. Anybody, anything else? I'm gonna zoom one more. So I would also like to have some feedback. So if you're up for it, add something to the Miro board. But what I was trying to do in these 22 minutes is explain a little bit about how I think successful product teams work cross-functionally, because you have to work cross-functionally. You can't do it alone. My learnings around retention. So the understanding of, from the activation point, how do you keep people engaged over time? How do you build this engagement machine? And hopefully I could also show you a little bit how we applied this. How do we went from our first step as the virtual consultation, building another use case by adding the digital pathway, the diagnostic pathway, to then also now build more on frequency and intensity by offering mental health. And I think there will be tons of more things to come. That would be me.
Thank you so much, Ruth. That great presentation, and thanks to everyone for the questions. Do feel free to keep interacting on the Miro board, send Ruth feedback, and connect with her on LinkedIn or Twitter and keep asking questions. But thank you so much for sharing your insights, Ruth. Great presentation.
Thank you. Oh, I'm all red by now. There we go.
And I need to turn the light on. So I'm sitting in the dark. What a pair we are. Thank you so much, everyone, for tuning in. But really huge thank you, Ruth, for joining us and on the virtual stage today.
No worries. Talk to you soon. Bye.
Bye-bye.